Live. All right, good morning. This is Senate Health and Welfare. It's April 21st. And this morning, we're looking at H 46, the Rare Disease Advisory Council. And then we'll also be looking at the opioid payment fund. So just going to say good morning to Danielle. Come on up. And Danielle, share with us your interest in H46. Just have to see that possible. And we're going to introduce ourselves to you, and then you introduce yourselves to us. Tell us about your cancer. We'll start over here first.
John Morley from Orleans District. John Benson with the Orange District.
Jenny Lyons, Jim South.
I represented Arlington, New Ski.
So, I have you listed as a pediatric cancer advocate. So, why don't you tell us who you are, your testimony?
So I'm Jane Jankowski. I'm from right here in Vermont. I also am a pediatric cancer advocate. I also CCMA, working my way to pediatric nursing oncology.
Wonderful.
My interest is, I also have two children with Beckman-Friedman syndrome, which is why I'm here. I also have a child who passed away from neuroblastoma cancer 2 years ago, which is why I'm here. I think this is a very important map. So I'm going to get into testimony.
Please do.
All right. Good morning, members of the committee. My name is Danielle Jankowski. I live in Pittsburgh, Vermont. I am a pediatric cancer advocate, and I'm also a certified clinical medical assistant. I am going to tell you why I am in this field. I didn't just stumble into medicine. I fought my way into it. I became a certified medical assistant to get my foot in the door. I became a certified medical assistant for a very specific mission. I am working my way to become a pediatric oncology nurse. And I am doing that because of my daughter, Samara. Because of the medical professional, because of what the system did to Samara. In her journey, I saw firsthand how the system failed when it was confronted with the rare and the complex. I saw the silence that happened when the doctors didn't have the answers. I saw a mother myself being ignored, and my child suffered. I decided that I would never let that happen to another child if I could help it. I am trained to be a voice that my daughter Samara needed, and a voice for another child in Vermont that is going to need when it's facing a terrifying diagnosis. But it's just as much as one person as a nurse or assistant I can only do so much. And a broken system is. That is why we need H46. My fight isn't just in the past. It is my everyday reality. 2 of my children live with Beckman-Friedman syndrome, BWS. Because it is a rare overgrowth disorder, my children live with a constant and universal childhood cancer. Our lives are Our lives are dictated by the scans every 3 months. We're in the clinics for ultrasounds, chest x-rays, urine cultures, and blood work to check for tumors. As someone who is studying to be in the nursing field, I understand the clinical high risk of BWS, but as a mother, I see the gaps in Vermont care. We are often the ones teaching the providers about the protocols. We are the ones coordinating between specialists who don't talk to each other. And if a future oncology nurse is struggling to navigate the system, imagine about the parents who have no medical background at all. H46 is a bridge between the parent's intuition and a child's survival. A rare disease advisory council ensures that the lived experience of families like mine is finally used to build a better roadmap for Vermont. I have done the work. I have changed my career, my life, to be the advocate my kids and Samara deserves. I'm asking you to do your part now past H46 so that when a family hears a rare diagnosis, they are not met with a wall of silence, but with a system that is ready to listen. please pass H46. Let's make sure that Zamara's name stands for Vermont, that finally learned how to fight for its rarest children. Thank you.
Thank you. You've been through a lot.
Yes, ma'am.
Yes. And you've learned a lot. It's one of the most difficult things to care for a child. Is some unknown there. Seems. Thank you. Questions? When do you finish your studies?
I actually just took 2 months off. I am also a licensed foster parent now. I graduated last month for my CCMA. I had 2 foster kids fall in my lap right before Christmas. Another one I took in before the state took her. Her parents no longer want her, so I happened to just take her. So I happened to just put my career on hold. I also working very hard for my advocacy right now. I'm working with Dan Raymer from the CAC too. I just got off the phone yesterday with my Zoom meeting with Hannah Snyder for a task force every year. My advocacy is a very part of me right now. So I put my studies on hold for the kids and my advocacy right now. So I another 2 months I'm going back to school for my oncology work. So that's right now. Just it's on hold for a second.
Thanks for everything you're doing. It's unbelievable.
Yeah.
One person knows.
Thank you, and just to tell you that your testimony is probably the most powerful testimony we've heard so far on this bill. We've heard a lot of really amazing things, but this was really important to hear, so.
Well, thank you for having me. Appreciate it.
Thank you. And I think you may get your wish in this.
I hope so.
Oh, very good. Thank you.
Thanks.
There you go. This draft 2.1 new.
Yes. I can read it. If you go on the single down.
Meeting then Office of Legislative Council and post the draft for you.
Yep.
Thank you, guys.
Yep.
So here is draft 2.1. A few small changes since the last time you've seen it in the long COVID section based on changes provided to you from the health department. But otherwise, this draft should look familiar. I've retained the old highlighting, with the hope and intention that makes it easier for the House to see what the changes are. So I will have a document with all of the highlighted changes in one place. But for our purposes, the changes are here in the long COVID section. So long COVID resources for primary care providers and patients on or before January 1. Next year, the Department of Health shall collaborate with the University of Vermont Medical Center, the Vermont Medical Society, and patients with lived experience of long COVID to identify existing evidence-informed standards, best practices, and training for primary care providers regarding long COVID, and distribute these resources through the department's website and to primary care providers, and in collaboration with Dale, identify support services for long COVID that include a range of peer and community-based programs, such as long-term support groups through the University of Vermont Medical Center and the Vermont Center for Independent Living or another entity, and strategies to support patients who are homebound or at risk of becoming homebound. And then you have this definition of long COVID that you had in the previous draft. So that's the new language. Would you like me to go back up to the top to sort of refresh your memory about what this bill contains?
I probably should do that quickly. I just have one comment. on number 1 on page 6. So yesterday I received a really fabulous public health prevention newsletter. And I'm looking at Jessica. And so I'm wondering, is there a link here with any other newsletter that the Department of Health puts out in addition to the website? That we could say, the website, newsletter.
Jessica Shipano, Department of Health. Thank you for that. And since we had discussions on the markup that we did previously, we've been exploring what those different communication pathways are that we could potentially utilize, like directly to providers, to other folks. I think it would be helpful if we leave the language as flexible as possible, and we can certainly continue to work with the committee on that. So this distributing the resources through the department's website and primary care providers would allow us to use any of those channels.
So you are thinking about
Yes.
additional
Yeah,
communication?
absolutely.
Okay, well, we can just leave it. We could say, or other means of communication. Can we put that in something?
Yeah, and subdivision 1,
Is that where it goes?
I'm not sure. Identifying specific evidence of fronting.
That's best practices. I just am thinking. How to get the word. Jen.
It's the part for
Support services or other resources right there.
Sure.
Identify support
Yeah, that's
services.
fine. That's good.
Or other resources.
That looks. And it's. Thank you.
Yep.
Is that okay for anything? Yeah. All right, so why don't we go to the top unless someone else has it. So we can do it.
So first in subdivision 1, you have your findings. First finding is that lack of awareness contributes to common and harmful obstacles that rare disease patients face, such as delays in diagnosis, misdiagnosis, lack of treatment options, high out-of-pocket costs, and limited access to medical specialists. And secondly, with the support of the National Organization for Rare Disorders, various patient organizations and stakeholders in the rare disease community, rare disease advisory councils are enabling states to strategically identify and address barriers that prevent individuals living with rare disease from accessing adequate and effective treatment and care for their condition. And then we have section 2, which creates a new chapter in Title 18 specific to rare diseases. So far, there'd be one section in this chapter, and that is the creation of the Rare Disease Advisory Council. Subsection A creates the council within the Department of Health to provide guidance and recommendation to the public, General Assembly, and other government agencies and departments as necessary regarding the needs of individuals living with rare diseases in Vermont. Membership, we have 2 individuals living with a rare disease, at least one of whom is an older Vermonter appointed by the Commissioner of Health. A parent or guardian of a person living with rare disease appointed by the Commissioner of Health. The Commissioner of Health, the Commissioner of Dale or designate. A representative of the Health Equity Advisory Commission. An academic researcher who conducts rare disease research appointed by the Commissioner of Health. A physician practicing in Vermont with experience treating a rare disease appointed by VMS. A nurse practicing in Vermont with experience treating a rare disease appointed by the Vermont chapter of the ANA. A pharmacist practicing in Vermont appointed by the Vermont Pharmacists Association. A geneticist or genetic counselor appointed by the Commissioner of Health. Any other persons deemed necessary by the Commissioner. And then we have this language, maybe paragraph 2, new on the Senate side, not new today. That members of the advisory council shall be appointed for staggered 5-year terms. Any midterm vacancy shall be filled by the appointing authority for the remainder of the unexpired term. Term shall begin on January 1 of the year of the appointment and conclude on December 31st of the last year of the member's term. Members of the council may serve multiple terms either consecutively or intermittently. Instead of shall, we now have the advisory council may collaborate with other relevant stakeholders, including NORD. Subsection C, we have a list of powers and duties for this group. The advisory council may conduct the following activities for the benefit of individuals impacted by rare diseases in Vermont. Convene public hearings and solicit comments from individuals impacted by rare diseases to assist the advisory council in creating a needs assessment, identifying gaps in services for individuals with a rare disease in Vermont and needs for their caregivers and providers. Provide testimony and comments on pending legislation and rules that impact Vermont's rare disease community. In consultation with experts on rare diseases, develop and provide policy recommendations that do the following. First, identify conditions for the Department of Health to consider as part of appropriate screening guidance and recommendations. And secondly, support timely patient access to diagnostic services and treatment and enhance quality services provided by rare disease specialists. And lastly, any other activities identified by a majority of the advisory committee. We have language. The advisory committee has assistance from the Department of Health. The department shall maintain a webpage on its website that contains notices of upcoming meetings, meeting minutes, public comments, and reports. And then there is a reporting requirement that's as needed. The advisory council may submit recommendations for legislative action to the various policy committees. In terms of the meetings, the Commissioner of Health or the Commissioner's designee shall call the first meeting. Annually, the advisory council shall elect a member to serve as the chair. The advisory council shall meet quarterly, and the meetings may be held in person or remotely on an electronic platform in accordance with the open meeting law. Majority of the membership constitutes a quorum. And if there are any members who are not otherwise compensated for their participation in the advisory council, they'll be entitled to per diem compensation and reimbursement for not more than 4 meetings annually. And then we have this language on long COVID that we just went over. The piece we didn't go over is this February 1/27 report, or the presentation, doesn't say report. Present recommendations to the various policy committees on providing long-term disability supports to individuals experiencing long COVID. And then the effective date is July 1/26.
Okay. Any questions? Anything else? We good with it?
It's exciting that it's on COVID.
I think it's true. Mike, I'm wondering how the House will receive the one thing I think the House may have questions about. I don't know. Having the commissioner do so many of the appointments, but we'll just have to see if they take fine with me. What were that we made changes from the other people who were making the appointments in the underlying bill.
It had been pro tem and commission.
Yeah.
Yep.
Right, so it just seems like having the pro tem or the speaker make those appointments are gonna go through a group that knows about this, but it would. Out there, the speakers of operating diseases. Right? Yeah, so we'll see. All right, so thoughts on this committee, I would entertain. Oh, it's about time for history.
I'll make a motion to pass favorably the
It's gonna be 3.1. Yeah,
They just changed.
I updated it.
version 3.1.
I'm sorry.
That's okay. On April 21st.
Is that the date?
Yep.
Yeah.
Discussion? Okay,
Senator Benson. Yes. Senator Cummings,
yes.
Senator Dooley,
Yes.
Senator Morley. Yes. Senator Lyons.
Yes,
5-0.
excellent. Good work. This bill means a lot to so many different people. It's amazing. There's people we don't know about. They can't speak up for themselves on a regular basis. Okay, so, that's good. Thank you, Katie. We're good. We'll come back to page 660. No one is coming in. So, but I'll go away.
Okay.
I'm wondering if, we have a new draft. Yeah. Do you want to walk through the draft now or wait until no?
I can walk through it now.
Okay, let's do that.
Making a note to myself.
Just
to-
hold, just give us a break here for a second.
Sure, send you a theme.
We go happy.
Let's just go off for 4 minutes until back on.